Good day everyone, I am 𝐬𝐨𝐜𝐿𝐴 canumay from BSN 111B, and today I will be showing you my return demonstration in performing a complete bed bath. Bed bath means bathing a patient who is confined to a bed and cannot have the physical and mental capability of self-bathing. Bath is the act of cleaning the body and is given for therapeutic purposes. It is also done to stimulate circulation to the skin. So before conducting the procedure, I am going to prepare all of the equipment needed to conserve time and energy. So the equipment that I'm going to use first is the basin with warm water, liquid soap, alcohol for hand hygiene and disinfection, moisturizing lotion and deodorant, shaver and a comb, eye patch and eye drop, clean pair of gloves, a bath blanket, 3 bath towels, a washcloth, a clean gown, and a clean top sheet. And lastly, we have a laundry basket. So the organization and completeness of all the necessary equipment needed ensure our efficiency as student nurses. Okay, so I have already closed the doors and the curtains for my patient's privacy. So this is important since hygiene is a personal matter. Now I'm going to perform proper hand hygiene to deter the spread of microorganisms. Also, I'm going to wear gloves to protect myself and of course my patient from cross-contamination. For the introductory phase, I am going to introduce myself to the client and verify the client using 2 identifiers. This is done to ensure that I am doing the right procedure to the right client. Also, I'm going to explain to the client the procedure that I'm about to do. This is done since an explanation facilitates understanding and cooperation. Good day, sir. I am 𝐬𝐨𝐿𝐴 canumay, your student nurse for today. Can I see your wristband, please? Can you state your name?
I am Patrick Anay.
Your birthday?
It's on April 26, 2002.
Okay. And how would you like me to call you?
Just call me Mr. Patrick.
Okay, Mr. Patrick, today I'm going to do a bed bath, which means I am going to wash your body to remove the accumulated dirt, oils, and perspirations on your skin. And of course, for you to feel refreshed and relaxed. Would that be alright?
Yes, it's alright.
Okay, so let's get started. So now I'm going to ask the patient whether he wants to use a toilet or commode. So Mr. Patrick, would you like to void at this time?
No thanks, I'm good.
Okay. So naturally, in a clinical setting, I have to raise the bed in a comfortable working height and lower down the side rails at my side. This is to promote good body mechanics and ensure the safety of our patient. So after doing that, I'm going to assist my patient to move closer at my side. So Mr. Patrick, I need you to move a little bit, okay?
Okay.
Okay. So now I'm going to place the bath blanket over the patient. Okay, Mr. Patrick, can you hold this for me, please?
Okay.
And now I'm going to remove the soiled top sheet. So this is to ensure warmth, privacy, and comfort to the patient. And then I'm going to place this on the hamper. So after that, I'm going to remove the patient's gown. So if the patient has an intravenous line injury or decreased mobility, begin at the unaffected side. So Mr. Patrick, I'm now going to remove your gown, okay?
Okay.
Okay. Okay, so I'm going to proceed to the other side. Okay. Now that I have removed the patient's gown, I have here a basin with warm water. It is about 2/3 full and it is 43 to 46 degrees Celsius. But first, I'm going to let my patient check the temperature if it is tolerable for him. So, Mr. Patrick, I need you to stick your hand into this basin and tell me if it is too hot or too cold for you, okay?
That's good for me.
Okay. Now, I'm going to remove the pillow under the patient's head. Okay, so this is only applicable if the patient's conditions allows and raises the head of the bed for about 30 to 45 degrees. Okay, so now for washing of the face, the first thing we're going to do is to place the bath towels appropriately. So the first bath towel should be placed under the patient's head. Okay, and now for the second bath towel should be placed over the patient's chest. So, Mr. Patrick, are you wearing any contact lenses?
No, I don't use any.
Okay, so now I'm going to wash your eyes first, okay?
Okay.
Okay, so for washing the patient's eyes, the first thing we're going to do is to soak the washcloth into the water. Okay, so this is the washcloth and I'm going to soak it into the water and then rinse it thoroughly. And then we're going to fold it to create a bath mitt. So this is to retain the heat and water and prevent dragging the washcloth into the skin. Just like this. So now I'm going to start from the inner canthus towards the outer canthus using the separate section of the washcloth for each eye. So this is to prevent the transmission of microorganisms from one eye to another. Okay, so now after drying the patient's eye, we're now going to proceed in washing his forehead, cheeks, ears, nose, and neck. So Mr. Patrick, would you like a soap to be used in your face?
No, thanks.
Okay. Okay, so now I'm going to start in his forehead. And then cheeks, and then nose, ears, and then his neck. Okay, so now I'm going to ask the patient whether he would like to be shaved. So, Mr. Patrick, would you like me to shave you today?
No, thanks.
Okay. So, if the patient is unconscious, we need to wash the patient's eyes using warm water only, starting from the inner canthus towards the outer canthus, using the separate section of the washcloth for each eye. So, again, this is to prevent the transmission of microorganisms from one eye to another. Okay, so if it is prescribed, we need to instill ointment or eye drop on the patient's eye. So if there is no blink reflex, we need to keep the eyelids closed and place the eye patch on the patient's eyes gently. Now, for washing the patient's arms and hands, the first thing we're going to do is to expose the forearm of the patient and place the bath towel lengthwise underneath the patient's arm. So now I'm going to remove this towel. Okay. And then I'm going to fold it lengthwise. And then I'm going to expose the patient's arm. Okay, and then I'm going to place this bath towel underneath his arm. So now I'm going to start washing my patient's arm first in a distal to proximal manner using a long, firm strokes. Okay, and now I'm going to proceed with his hands and fingernails. Okay, and I'm going to let my patient raise his arms over his head and lightly support it. Okay, and now I'm going to start washing his axilla. And then I'm going to put some deodorant. Okay, and after that I'm going to proceed to the other side and repeat the whole procedure. Okay, so now I'm going to expose the left arm of my patient. And then I'm going to place the bath towel underneath his arm. And then I'm going to start washing his arm first. And then I'm going to proceed with his hand and fingernails. And then I'm going to let my patient raise his left arm over his head and lightly support it. And then I'm going to start washing his axilla. And then I'm going to dry his axilla. And then I'm going to put some deodorant. So now I'm going to proceed in washing the patient's chest and abdomen by placing the bath towel across the patient's chest while lowering the bath blanket towards his umbilical area. Okay, and now I'm going to lift the bath towel and I'm going to start washing his chest using a long, firm strokes. I'm going to dry his chest. Okay. Now, always remember to pay attention to the skin under the breast, especially in females, or any skin fold areas, particularly if the patient is overweight. Because as we all know that skin fold areas are prone to sweating or perspiration, therefore bacteria will drive us into those moist areas. So now I'm going to proceed in washing the patient's abdomen by placing another bath towel in his abdomen. And then I'm going to lower down the bath blanket toward his pubic area. And then I'm going to start washing his abdomen using a long, firm strokes. Okay, so now that I'm done with his chest and abdomen, I'm going to proceed now to his lower extremities. Now, in order for me to wash the patient's leg, the first thing I'm going to do is to expose the patient's leg by folding the bath blanket towards the midline, keeping the perineum covered. Now I'm going to place the bath towel lengthwise underneath the patient's leg. Okay, now I'm going to start washing the patient's leg using a long firm stroke, starting from the ankle towards the knee and then knee towards the leg. Okay, so now I'm going to proceed in washing his foot, toe, and toenails. Okay, now I'm going to put some moisturizing lotion to moisturize the foot of my patient. Okay? So now, always remember that in soaking the patient's feet for about 10 minutes would help maintain the cleanliness of the feet, toes, and toenails. But we must also remember that we must avoid soaking the patient's feet with diabetes or impaired sensation because it might cause harm or injury to them. Now that I'm done with the patient's right leg, I will now proceed to the other side and repeat the whole procedure. Now I'm going to expose the patient's left leg by folding the bath blanket towards the midline, keeping the perineum covered. Okay, now I'm going to place the bath towel lengthwise underneath the patient's leg. Okay, now I'm going to start washing the patient's leg. Okay, now I'm going to proceed to his foot, toe, and toenails. Okay, and now I'm going to put some moisturizing lotion. Now that I'm done with my patient's anterior side of the body, I am now going to discard the washcloth and maintain the patient's privacy. Refill the basin with clean water and change a clean pair of gloves and apply perineal care as necessary. So now with a newly refilled basin, washcloth, and new pairs of gloves, I am now going to perform perineal care to the patient. Now I am done with the perineal care. I am now going to proceed at the back of my patient. So I have done a new set of gloves and I have refilled my wash basin with warm water. I am now going to assist my patient to a prone side lying position so that I can clean his back. Okay, Mr. Patrick, I need you to lie facing at your side, please.
Okay.
Okay. Okay, now I'm going to place the bath towel alongside at the back of my patient and his buttocks while keeping the patient covered with bath blanket as much as possible. Okay, now I'm going to start washing the back of my patient, starting from his shoulder towards his buttocks and upper thighs, while keeping special attention to the gluteal folds. Okay? Now, if the patient's skin is intact, remove the gloves and discard it, and ask the patient whether he would like to be given a back massage. Okay, Mr. Patrick, would you like me to give you a back massage?
Thank you, but no thanks.
Okay. So now, if the patient does not want a back massage, I'm now going to put a moisturizing lotion on his back. Okay, now I am done bathing my patient. So Mr. Patrick, you can now roll back. Okay, and now I'm going to help my patient wear his new clean gown, and I'm going to check the devices attached to the patient. So Mr. Patrick, this is your new clean gown, and I'm going to help you wear it, okay?
Okay, thank you.
Okay, so now I'm going to help my patient with his grooming by combing his hair. Okay, Mr. Patrick, we are now done with your bath. So how was your feeling?
It was totally great.
Okay, that's good to hear. So since we are done here, I'm now going to head out to let you have some rest. And if you have anything, if you need help, just don't hesitate to call using the button at your side, okay?
Okay.
Okay, and I'm going to go back and to attend your needs, okay? Okay.
Thank you so much for your service.
Okay. So now, after the procedure, I am now going to perform the aftercare of the equipment that I have used to maintain the orderliness and cleanliness of those equipments. Now that I'm done, I'm now going to perform proper hand hygiene to prevent the spread of microorganisms. Also, I'm going to document the procedure that I have done. Okay, so that's it for my return demonstration. I am 𝐬𝐨𝐜𝐿𝐺 canumay from BSN 111B. Thank you for watching.